In this video, we are going to introduce you to the story of John Smith. When John started selling Medicare supplements, he used direct mail campaigns to generate his leads for Medicare supplement clients. John typically generated response rates between 5 and 6%. His cost per 1,000 pieces was only $325. His average cost per lead was between $5 and $6. A normal week for John was based upon contacting all of the people that had responded to his direct mail campaigns. As John contacted each person, he would encounter people who were on Medicaid, group health coverage, original Medicare only, Medicare supplement plans, and occasionally a Medicare Plus choice plan. John understood the math. Out of the 5 situations that he would routinely run into, 2 out of the 5 situations were what he considered Medicare supplement leads. If all things were equal, that meant that for every 1,000 pieces of mail that he sent out, he would receive 50 to 60 leads, and out of those responses, about 40% would fit the criteria for a Medicare supplement sale. That meant that his actual usable lead return was around 20 to 24 leads. His actual usable lead cost ranged between $13 and $17. His average commission per sale was about $250. If he sold 2 out of 20 usable leads, he made all of his money back and cleared a small profit. Any sales on the other leads were 100% profit. Life was good back in 1999. Everything was simple. Over the next several years, John's business rolled right along, just as it had in the past. Nothing really changed other than the increasing postage rates, which affected the cost of his mail campaigns. In 2003, the federal government passed a new law called the Medicare Prescription Drug Improvement and Modernization Act, which made some changes for the insurers that offered Medicare Plus choice plans. At that time, Medicare Plus choice plans were given a new name and were called Medicare Advantage plans. The national media promoted the new law as the largest overhaul of Medicare in the public health program's 38-year history. All of a sudden, it seemed like agents promoting Medicare Advantage and prescription drug plans were everywhere. The insurers and agents had declared war on the Medicare supplement industry. John received several calls from his clients that year calling to tell him that an agent had enrolled them in a Medicare Advantage plan without their permission. The clients thought that they were just enrolling in a prescription drug plan. They wanted John's help to get things fixed. John soon noticed that the local hospitals had joined the Medicare Advantage cause. All of the major hospitals within 50 miles of John's office started their own Medicare Advantage plans. All of a sudden, Medicare Advantage programs were everywhere. This was a completely different situation from anything John had ever experienced in the past. It was a new world of Medicare Advantage versus Medicare Supplement. Over the next several years, John felt like he was spending more time conserving business against these new Medicare Advantage plans than focusing on obtaining new clients. After all, Medicare Advantage plans were advertising on the television, radio, and conducting massive direct mail campaigns. The number of agents selling Medicare Advantage plans seemed to increase by the day. The problem was that between the commercial insurers and the hospital-based plans, most people had several options for Medicare Advantage plans that incorporated the medical providers they currently used. The majority of the plans had 0 premiums and annual maximum out-of-pocket limits less than $2,500. John felt like it was the Wild West, only he was the one standing out in the middle of the street while all of the Medicare Advantage companies and agents shot at him from the rooftops and windows. In 2007, John felt like things were starting to take a turn for the better. After all, he knew that this unregulated Wild West mentality would have to eventually come to an end. John realized that everything he had experienced over the last several years had gotten the attention of regulators and the national media. According to NIAC reports, many states were reporting complaints about inappropriate or confusing marketing practices leading beneficiaries to enroll in MA plans without adequately understanding the coverage into which they were enrolling. In some cases, beneficiaries believed that they were signing up for a PDP, or a Medicare Supplement plan, rather than an MA plan, and they did not understand they were disenrolling from original Medicare. States reported that in some instances, consumers inquired about a Medigap plan or a standalone PDP only to be signed up for an MA plan without their knowledge or their understanding of the limitations of such a plan. In the upcoming months, new marketing guidelines for Medicare Advantage plans were put into place, and it seemed like the aggressive sales environment surrounding Medicare Advantage plans had finally come to an end. John felt like he could get back to work, get on track, and that it would be business as usual. After all, it had been a rough few years. John wasn't the only one that felt this way. Soon, new insurers were coming out of the woodwork. It seemed like every few months, there was a new company entering the Medicare Supplement market space. John knew it was time to fire up the mailing campaigns again. He needed to fill that funnel of Medicare Supplement prospects. So John decided to create the largest mail campaign he had ever done. He was going to mail 10,000 pieces. The only issue was that his cost per 1,000-piece mailing had gone up to $425 because of increased postal rates. John was so excited, he couldn't wait to see all of the responses. He figured that there would be between 500 and 600 responses. This was exactly what he needed. Based on his old math, he should have between 200 and 240 good Medicare Supplement leads. Over the next several weeks, John waited patiently for this avalanche of leads. However, to his dismay, he only received 110 leads. John was sure something was wrong, so he immediately called the mail vendor that he had been using for years to find out what had happened. The mail vendor explained to him that the changes in guidelines for Medicare Advantage plans had caused all of the Medicare Advantage companies to flood the market with continuous mail campaigns. People were getting inundated with advertisements through the mail. This had caused the return rates to drop to 1 or 1.5%. John was beside himself. He immediately went to his desk and dug out a calculator. He proceeded to divide his cost of $4,250 by 110 and realized that each response was costing $38.64. Using his previous formula, estimating that 40% of the leads would be in a situation that was conducive to a Medicare Supplement sale, by eliminating the responses from people on Medicaid, Medicare Advantage, and group insurance, he calculated that the cost per usable lead went from $13 to $17 to over $96. John quickly realized that he would have to sell at least 4 Medicare supplements out of every 10 leads just to break even. This was a big change compared to the past where he only needed 1 Medicare supplement sale to break even per 10 leads. All of a sudden, he found himself wondering if he would be able to make back that $4,250 that he had just spent on these leads. John realized that he needed a different plan, something that was more cost efficient. He remembered talking to another agent that he had met at a convention. The agent told him that he only worked the turning 65 market because it was cheaper. All he had to do was buy a list of names and contact them. John felt like this could be his solution as well. After all, he wasn't afraid to cold call people, and he was confident that he could make this work. He called the mail vendor that he utilized for his mail campaigns and ordered a list of everyone turning 65 in his area during the next 12 months. John developed his plan and quickly realized that it was a viable marketing strategy for him. It was a little more work than his direct mail campaigns were, but it was definitely more cost effective. As the months passed, it seemed as if numerous other agents had also discovered the turning 65 market. There were many more agents calling on the same people to sell Medicare supplements. Not to mention all of the Medicare Advantage agents as well. People were getting inundated with information during their open enrollment periods. This last month, John had contacted numerous people, and several of them wanted him to get back with them at the end of the month to discuss their options. John was glad that he had all of these follow-ups because so far, he was not having a very good month. As John reached out to all of the people, it appeared that the majority of them had already made a decision to enroll in Medicare Advantage plans. And then, to top it all off, a few of these people had purchased a Medicare supplement from some new company that offered rates lower than what he had originally quoted them. John felt like there was constantly a new company coming out with lower rates. It seemed like a full-time job just trying to keep up with the latest and cheapest Medicare supplement. As John sat in his office staring at his computer, He thought about how much the industry had changed since he started selling Medicare supplements. He started to wonder if he shouldn't have given up on the Medicare supplements and focused on Medicare Advantage. Or maybe the answer was to do both. He didn't really like the idea of all of the certifications and marketing guidelines involved in selling Medicare Advantage plans. As he sat at the computer, he decided to Google changes in the Medicare market. A link popped up on a brief from the Kaiser Family Foundation titled Medicare Advantage and Traditional Medicare. Is the balance tipping? The brief stated that in 2015, nearly one-third, 31%, of the Medicare beneficiaries enrolled in a Medicare Advantage plan. That was an increase from nearly one-quarter, 24%, in 2010. John realized that there was no denying the impact that Medicare Advantage was having on the marketplace. When John finished reading the brief, which confirmed the overall decrease in the total market share of people purchasing Medicare Supplement coverage, he clicked on the next brief. This one was titled Medicare Advantage 2016 Spotlight, Enrollment Market Update. The brief stated that out-of-pocket limits for MAPDs would be higher in 2016 than in 2015 on average. In 2016, 2/5 of plans, 39%, will have MOOP limits equal to the maximum of $6,700. As you read further through the brief, it stated that in 2016, only 1% of MAPD plans offered nationally had an annual out-of-pocket maximum of $2,500 or less. John reflected back to when most of the Medicare Advantage plans in his area had a maximum out-of-pocket limit of less than $2,500. He suddenly realized just how much the out-of-pocket exposure for Medicare Advantage plans had changed throughout the recent years. When John finished reading the brief, he remembered receiving several emails regarding hospital indemnity plans designed to wrap around Medicare Advantage plans. He remembered that the commissions on those products were much higher than on a Medicare supplement. One email stated that the average premium was about $50 a month. Again, John got out his calculator. He wanted to check the impact that these products could have if he were to try direct mail again. He used to figure that 40% of his responses would be good for a Medicare supplement presentation. But if 31% of the people have a Medicare Advantage plan, that would mean that over 70% of his responses would be good leads if he offered Medicare supplements and hospital indemnity products. Even if he only got a 1 or 1.5% response, just like before, 70% of the leads would be good leads instead of 40%. Because the commissions are much higher on the hospital indemnity products, John calculated that if he sold one couple per 1,000-piece mailing, a hospital indemnity plan, that he would make the entire cost of the mailing back and still make a profit. John realized that this would solve his problem when it came to utilizing direct mail marketing campaigns. He felt confident that he could again excel in the future. The important thing to remember is that you can increase your usable leads and commissions by utilizing hospital indemnity plans, just like John.
All of us at the JLS family of companies hope that you have enjoyed this sales training presentation.